we will go straight into it to introduce our guest speaker for the day, Professor Macharia Isaac. He's a specialist ENT surgeon and the founder partner at the Nairobi ENT Clinic. He's also the regional advisor East Africa for ear and hearing care. He's a member of the WHO expert panel on ear and hearing care, member steering committee of the World Hearing Forum, and recently retired professor, formerly of the ENT Department of Surgery, University of Nairobi. Let's all make welcome Professor Isaac Macharia. We are ready for you. Thank you.
Thank you, Dr. Ida, and good morning, everyone. I want to thank the Department of Obs-Gyne for giving me this privilege and opportunity to share my thoughts and experience on this very important topic of entrepreneurship in medicine. I think Dr. Ida has done that introduction, and the question is, what gives me, what qualifications do I have to give this talk? First, a disclaimer, I have not chewed books on entrepreneurship, and what I'm going to share is really experience that I've gained, both in private practice and also as a director and chairman of the Equity Group Holdings, positions that have given me the opportunity to work with people who have an entrepreneurial mindset. Sorry, I'm very sorry. The first starting point is...
You can put on your video.
Yeah, okay, let me see.
Yes, we can see.
I have some light in the background, I think. Yeah, I hope that's good. To start is looking at a quote by William Osler in the 18th century, that the practice of medicine is an art, not a trade, a calling, not a business, and a calling that will exercise, in which your heart will be exercised equally with your head. And whether this perception has remained sometimes in the medical fraternity and has had an effect on the way we look at our practices of medicine. However, there is the changing landscape of medical practice has required additional skill sets for physicians, and including business skills. The major issue is that medical schools the world over have not kept up with this demand or need for additional skills. We need to understand overhead costs, employment and service level contracts. We need to be able to hire and manage competent teams. We need to grow our medical business and also understand what does branding mean, enhance efficiency and improve outcomes. So sometimes when we are brought up in an environment where we are constantly reminded that this is a calling, it is not a business, our mindsets are restricted, and we don't think, even when we are trading day and night, that we should learn our practices as a business. I have no idea why my slides are not progressing. Sorry. Again, they have gone two more. Now, why should we spend a morning discussing entrepreneurship in medicine? First, over the years, I have realized that when we stick to clinical practice, we are never promoted beyond history-taking, examination, investigations, differential diagnosis, and treatment. And I have realized this more after I've been in medicine for about 40 years, that I do the same thing, even when I sit in my private practice, that I did as an intern. And I also realized that unlike other professions, where sometimes charges, the fees that you raise is based on your seniority. This does not happen in medicine. If you contrast this with the senior lawyers, engineers, architects, there's very clear hierarchy. If you went to see a senior lawyer, they charge per hour, and they charge different from the senior lawyer to the pupil. And in these professions, they are able to create large firms that outlive them, but this hardly happens in medicine. And the question is this related to a socialization that medicine is a noble profession? Can this change for doctors? Surprisingly, even in a place like the US, in 2016, 88% of doctors felt that they were unprepared for the business of medicine. I wonder what is the percentage in Kenya. Then the question begs, who is an entrepreneur? Because we're going to discuss entrepreneurship in medicine. This is just a snapshot of who an entrepreneur is, because an entrepreneur is somebody who has various assets, various competence, skills. It is a person that usually will organize and manage, and at the same time assume the risk of an enterprise. This means that this person can take either a profit or a loss. And that is very important, because many times it is a hindrance to growing our business when we are very risk averse. And majority of doctors belong to this group of being very risk averse, so they don't want to take any risks. An entrepreneur sees an opportunity where others see chaos, contradiction, and confusion. In medicine, we have an opportunity to have what has been called the double bottom line, where you can make a profit and at the same time stay true to your calling and make an impact. Of course, currently, there is more talk of the triple bottom line, where you consider people and the planet and the profit together. The characteristics of an entrepreneur he or she has a strong sense of initiative, is persistent, has presence in their enterprise, they're innovative, creative, they create business from problem solving, and doctors are always solving problems. It's only that we are not able to create business from the problems that we solve. He or she is motivated, self-confident, nurturing, and is able to motivate teams. Why entrepreneurship in health? In Kenya, the public healthcare meets only 50% of the demand. The rest is met through private enterprise, faith-based organizations. This tells you there is a big opportunity because the demand is there. If you look at the interest by global equity funds, which have been scrambling for opportunities to invest in healthcare in Kenya, then you'd know somebody outside has smelled the coffee. They have seen that there is an opportunity in healthcare in Kenya, yet Kenyan doctors are not investing in equal measure. In Kenya, we have untapped human resources. We've seen recently, it's in the public domain that we have unemployed healthcare workers, including doctors and even specialists. Healthcare formed 4.3% of the GDP in Kenya in 2020, which means that it's a significant part of our economy. If you look beyond our borders, in the US, healthcare has been corporatized, and it means that our private healthcare, which is modeled on the US healthcare, will most likely be corporatized with time. Will we as Kenyan doctors be at the table or on the menu? Remember to translate the Kiswahili saying, when you see your friend's head being shaved, prepare yours. So it is very important that we start thinking entrepreneurship in medicine, because in America initially, a lot of doctors were caught unawares by the corporatization, and they became employees in organizations that previously they were running. And I think it is very important for us to prepare for this. It's going to happen, and it is already happening. And especially when you look at these equity funds that are investing in healthcare with limited timelines of about 5 to 7 years before they take out their profits. So the entrepreneurial mindset, it would take us out of our casual worker domain. Now, this casual worker domain is based on the fact that as a doctor, if you are running your own practice, you are like a casual worker, because the day that you don't report to your practice, then you don't earn anything, which is equivalent to the casual worker that goes to a construction site, that the day that they don't go to work, the day that they don't report to the site, they don't take anything home. And it is important for us as doctors to realize that it's only our quantum of income per day that is different from that casual worker. So we need to look at how do we move out of that domain. The other reason why it's important for us to consider entrepreneurship in health is to change the narrative of Africa being a land of startups, where every generation starts, the next generation doesn't build on what was started, and most of the times destroys it. Then this is what happens majority of times in our practices. We need to look at the opportunity to create value over the years that you work. Whereas cashing out on retirement from our practices has a developed potential, it potentially can become part of our preparation for retirement, where you would be able to sell out your stake if you have developed a business of medicine. As doctors, we work very hard, but we need to also learn to work smarter. Work harder, but also work smarter. One of the problems that I've realized is the fact that sometimes if you take the analogy of a large fish in a small pond, or being a small fish in a large pond, most of us doctors prefer to be the large fish in a small pond instead of being a small fish in a large pond, where you have increased maneuverability. Whereas in the large pond, many times there are restrictions. And I think this is where a change in mindset, a change in approach to our profession needs to come. It is important for us, as we consider the opportunities that are available in the healthcare, to think about the healthcare ecosystem. And this will remove a tunnel vision where we only look at healthcare in the small space where we practice. And the ecosystem is comprises of providers, payers, patients, diagnostic service providers, where most of us sometimes don't consider as areas in which we can also invest. There are pharmaceutical companies, medical device manufacturers, and understanding this ecosystem and the needs of the various stakeholders will provide us with opportunities for investment in healthcare. This is just a diagrammatic representation of the healthcare ecosystem, but you can also add consultancies and policy formulation, which can be forms of investments. Health research can also be made profitable. Human resource for health training can be profitable. And when you look at this whole ecosystem, you realize each one of us has an area that they have strengths. You find, for example, when you look at technology providers in healthcare, there are limited number of doctors in this space, yet it's a space we understand. It's a space that we can play very well, because when other people are trying to solve our problems in healthcare through technology, they may not understand healthcare as well as we do. The types of entrepreneurships are many. There is the small business, which, if you look at the how do we describe or how do you categorize more businesses in different areas? They are categorized differently. It may be based on your annual turnover, profitability, number of employees. But we as doctors, majority of us have already sort of categorized ourselves in this small business by the fact that we know our clinics as kiosks. When we refer to our clinic as kiosks, again, the kiosk mentality means that it's a mentality of starting a business that is not, you don't intend it to grow, because part of this is what small businesses are. As opposed to scalable startups, startups that at the beginning are seen as businesses that can grow, that can scale up the service that is being given or the product that is being offered. Again, we do find that we fit into imitative type of entrepreneurship, because we almost, we leave medical school, after our graduate school, we look at doing exactly what our colleague is doing, or doing what our senior colleagues are doing. And you find that there is very little innovation in terms of service provision. We may not be in the hustler mode. Health can fit very easily into social entrepreneurship, where you would look at social impact, but at the same time making profit. There are the buyer entrepreneurships where the buyer relies on financial muscle to buy companies, and usually develop them a little bit and then spin off. And of course, the large companies that survive because they keep innovating, they keep disrupting themselves all the time, that even though they are large, within themselves, they have to have a startup mentality. So again, I want to emphasize our kiosk mentality that hampers us from thinking widely, from looking at healthcare business from an entrepreneurship perspective. I will go on to private medical practice, because this is where entrepreneurship is very important. You could be a sole practitioner, you could be in a partnership, you could be in a limited liability. If you are in partnership or limited liability, you need to make sure that you develop a detailed partnership deed, which governs the relationship between the partners, and many times will be used to resolve disputes. You need to understand some of the legalese, because ignorance is no defense. And where it comes to business, I have discovered surprisingly that we are very casual, that we don't look at the contracts that we sign. And you'll find that even when it comes to the way we invest, that many times we don't try to ask ourselves whether that is the best investment that will give us the best return on our investment. So I think we do need, and I'll come back to this later, in terms of making sure that we spend time to become financially literate. Now, the stages of, again, a private medical practice, wherever it falls in this category, is that there will be the first ideation, where the idea strikes. Then ideally you would have a business plan. Many of us don't develop a business plan. We jump straight into the deep end. Consider the financing that is available for you. Are you going to finance from your own resources, borrow from family, borrow from your spouses, borrow from Shylocks, borrow from financial institutions? It is again very important to spend time to understand how you're going to finance your practice. And then, of course, after sorting out the issue of financing, is the setting up, operationalization, and now entering into the growth phase. how do we create value in private practice? Because this is very important in the long term. We must, one must choose the appropriate type of practice. Some people will thrive in sole practices. Others will find that a partnership is the best way to go. Limited liability company will be the best way to go. So each of us must choose. Obviously, because of my experience, I do find that partnerships, limited liability company, increase your scope and improve the way that you both create value and sustain that value, and make use of different capabilities from the different partners. You need to, by creating value, determine what are the services that you provide. And it is very important to try as much as possible to integrate the value chain as much as possible. When we talk about the value chain in medicine, we are talking about the different aspects of the provision of healthcare, from the consultation that you do to the diagnostics that you use to provide that healthcare. And you may find that it is possible for you to integrate to provide more than just a consultation. And that is a value chain. You hear that even in agriculture, that you get much more value if you integrate a part of the value chain in agriculture. Subspecialization is also an avenue of creating value in your practice. I'm talking about subspecialization because I know majority of the people that I'm speaking to this morning are either undergoing postgraduate training or they are already qualified, they are specialists in their own area. Developing a brand is very important. And sometimes a brand doesn't have to have a name. People in themselves become brand. And this is based on consistently providing a high quality valued service. And then what is your business model? You could look at a business model where you have a high volume, low margin business. It means that you have to see very many patients or have a product that you have to sell in mass, or low volume, high margin business. Sometimes this means that you have discovered a niche, which the service that you provide is in high demand, and the people that you provide to are willing to pay premium for this service. Very important for us to constantly think about business development, because when you look at the environment within which you practice, it keeps changing. A couple of years ago, when NHIF was open to private practice, there are players in the healthcare field that took maximum advantage of this. And as of, I think last year, you'll find that NHIF was paying between 60 to 70% of its the payouts to private enterprise and not to public enterprise. So you can see there is a disconnect there. Public enterprise provides maybe about 50%, but 70% of the NHIF money was going to private enterprise. Why? Because the private enterprise was quicker to take advantage of the NHIF payout, and public enterprise, the people that run public hospitals, did not wake up to the reality that this was an avenue for them to improve their health financing. Then you need to always understand who are your stakeholders and engage them constantly. Again, this goes together with your business development. Now, one of the biggest problem in healthcare is that we don't build trust. That we start our clinics, we do very well, and with the time, like happens to all motors, we will become infirm, we will no longer be able to carry on with our private practice, and it withers and dies. So how would you build trust? One is, of course, the enterprise must be successful. And for a successful enterprise, you must hire the right people, hire competent teams, train them, be innovative. And of course, your personal involvement is very important to build up this enterprise. Now, when we talk about hiring competent teams, sometimes if you look at the people we employ in our private offices, a lot of them live a lot. I mean, a lot of them, many times we will have gone to our villages, we employ our cousins. There's nothing wrong in employing our relatives, but employ people who are competent. And I can tell you, over 40 years, I have seen what the caliber of people that are employed by in private practices. Sometimes you learn about the caliber of these people when you want to hire and they apply for jobs, when you interview them, and you find out and they were in charge of an office and they are really lacking in skills. Develop processes, and especially governance is very important. Develop policies, develop policies of risk management, and commit yourself to operational excellence. Set up systems, appropriate systems, and again, take advantage of technology. In our practices, we seem to be very much averse to technology. The younger crop of healthcare workers are a little bit more accommodating of technology. A lot of the people in my age group and immediate following us are really averse to technology. And yet, technology is can be used as a lever in business to improve your business success. Very, very crucial if you have to build trust is mentorship and succession planning. If you don't mentor people, if you don't plan for your succession, whatever you'll have built will wither with you. And a question that we need to ask ourselves as doctors is how much residual value have you built in your practice over time? How much of that value that you have spent 20, 30 years building will be passed over to your successors? When we start thinking about that, because that allows us to look over time, instead of just looking at today, I have a very busy practice, I am making good money. What about in 10, 20, 30 years? And what is apparent is that most doctors destroy value in their later years of the practice. You have built this value, and as the age catches up with you, you start destroying that value until one day you just have to put a padlock to your practice or just walk away. And I think it is important for us to seriously think about the value that we build over time that gets wiped off in a very short time. And a lot of us need to be dissuaded from believing in the myth that doctors don't retire. This is reinforced by our patients who make us feel that we are indispensable and that if we go away or if we retire, who will take care of us? And a lot of doctors do think that, yes, doctors don't retire because you can practice even when you are 80. Your performance will definitely go down. I want to share a little bit of my personal experience in the next few minutes so that we have maybe a time for Q&A. We started Nairobi ENT Clinic with a colleague in 1994. Today, the Nairobi ENT Clinic has 6 branches. We have 12 ENT specialists, 3 of whom are locum, 6 associates, and 3 directors. We have a total of about 35 staff members. Over time, we have added services to the practice so that we are not just do consultation in ENT. We have audiology where we have diagnostic and hearing aids fitting, audiological diagnosis and hearing aids. We have a vestibular service where we deal with dizziness and vertigo, both diagnostic and rehabilitation. We have a speech and swallowing therapy service, a voice clinic, which is a joint clinic between ENT surgeons and speech and swallowing therapists. We have a sleep laboratory, which I believe is the first sleep laboratory in this part of the world for diagnosis and treatment of sleep problems. Here we also bring in other specialists, psychiatrists, psychologists, and neurologists, so that we develop a multidisciplinary approach. We have a facial aesthetics clinic and an allergy clinic. Now, these are services that we have ordered. This is an example of integrating the value chain in our areas of competence. We have developed a structured onboarding and progression pathway. Now that some of us are about to retire, we have embarked on now developing an exit policy for any person that wants to leave the practice on retirement. We have a policy on leaving the practice if you don't want to work with us. We've developed defined benefits for all doctors working with us, and we have encouraged sub-specialization among our associates and our directors. And this is very important because then we play we play to the competencies of everyone. And because of being a group, we are able to afford state-of-art equipment, because this equipment is not being used by one doctor, it's being used by a group of doctors. This is again a big issue that if you are a doctor who is say seeing 5 patients and you have an equipment that costs a couple of million shillings, when you do your maths, you may realize that it will take you a long time to recover your investment. But if you have 5 doctors, each seeing 5 patients, you will distribute the cost of that equipment, and you'll find that you are able to afford state-of-art equipment in a practice like ours. What are the challenges? Fraud is a challenge, and this applies to a lot of people. Now, fraud is not committed just by staff that you employ. And again, over the years, I've had lots of horror stories from doctors where their staff have defrauded them. We are defrauded by hospitals, insurance, and patients. And this is why it is important to build in systems and processes that will help you minimize this fraud. Challenges of financing. There's a problem of specialized healthcare financing in this country, that financial institutions do not understand the business of medicine. Therefore, you find they will lump us together with other SMEs, and yet we require a different type of financing. In some environments, you'll find that they have developed specialized health financing, so that, for example, if you qualify as a specialist, you will be financed because you are a specialist and you don't need to have collateral. My first attempt to obtain a bank loan for my practice was unsuccessful because about 30 years ago, because I was asked for a property, and I didn't have any property at that time. Now, if you, those of you maybe who have seen the growth of the Equity Afia franchise, it is trying to address this issue of health financing, although it is starting with a restricted group of doctors who are alumni of the Equity Leadership Program. These are doctors that were supported through their university education by Equity Bank. And the idea is that they are financed without collateral, and the collateral is their qualification. And I think we need to be moving into this direction. Then there's a question of staff retention. And here I'm not looking more at the administrative staff. I'm looking at a practice where you have a number of doctors, and then you find that after 2-3 years, the doctors, maybe especially at specialist level, they want to go and start their own clinics. So you need to be able to develop a system where these doctors feel that they have a future in that practice. Sharing patients in a practice is a big challenge with many doctors, but this is overcome by the doctors in that practice seeing the bigger picture that these patients should bring to them, should belong to the practice, and that everyone in the practice benefits from the patients that are brought in by the different members of the team. The doctors really must see that when you are in a partnership, when you are in a group, working with a group of doctors, that 1 + 1 is not equal to 2 and can be more than 2. And this becomes very evident. For me, it became very evident very early on when I discovered that when we are 2 or 3 doctors and we were working in different hospitals, when one hospital calls and I am occupied, that I would ask my colleague to go and see that patient, which means at that particular time, that patient does not get lost to the practice. That patient is brought into the fold of the practice. Whereas when I am alone and they say I'm a surgeon, I'm in theater, I am not able to see this patient, I would lose that patient. So that is what I call seeing the bigger picture. Some failures, because when I talk about entrepreneurship and I say that you take either a profit or a loss, yes, I have had various investments that did not work out. Invested in a diagnostic center that did not work out the way we had envisaged, in a pharmacy with colleagues again, and an original idea to develop a multi-specialty medical center started with other doctors. It didn't work, mainly because of lack of commitment, and a very early on attempt to develop a HMS system or invest in a HMS system. But when I look at all these failures, majority of them failed because of poor governance structures. And that is why I talk repeatedly about processes, about systems, and about people. But I am encouraged by Albert Einstein that says, anyone who has never made a mistake has never tried anything. So if you don't want to make a mistake, don't try. So what are the lessons that I have learned that I think are important? Crucially, financial literacy. It is important that we understand aspects of financing, aspects of investments, aspects of return on investment. Now, luckily today, you don't even need to go to somebody's class. Financial literacy is in the gadget that we carry around. All that we need is to allocate time to be financially literate. You know that a lot of doctors, by the time you qualify, many times we don't even know the difference between a debit and a credit. And this advantage has been taken of us because of this poor financial literacy. Many years back, I was having a chat with a bank manager who told me that they love doctors. And the reason why they love doctors is because the doctors' accounts, current accounts, always have money. Whereas when they compared the accounts of doctors and lawyers were moving their money every other day. They were looking at opportunities. Interest rates have increased in this financial institution, or even in the same financial institution, they will be negotiating constantly, so that if they have, for example, a fixed deposit, they know exactly how the interest rates in the macro environment were moving, and therefore they would go and negotiate from a point of knowledge with their bank managers. But the doctors, nothing doing. So we, like I said earlier, we work very hard, but we don't work smart many times. We need to understand the difference between equity and equality, that when we are in partnership, in terms of both our inputs and our contribution to the partnerships, we will not be equal, but there should be equity. When we talk about equity, we are looking at everybody is playing at their strength. For example, when we started our practice, I realized that my partner was much more at home doing the administrative part, and we divided work so that my partner, and for a very long time, I never even knew how salaries were paid in our practice, because my partner took on that aspect of the practice, and I took on the practice of external relations, doing the business development. So this is very important. And again, a lot of times the reason why we are not able to work in partnerships is because we are looking at trying to have equality in all aspects, but let's have equity. You should distribute responsibilities based on everyone's strength. This is the way that you unlock value from everyone. Very important is the governance structure. There is a great need for transparency and accountability, and then invest in systems and processes. You need to develop shared values, what would be referred to as your organizational culture, so that the people that you bring on board will share these values. Like I said, we have locums, we have associates, we have directors. From the locums, once they work with us for some time, we are able to determine those that have shared values, and these are the ones that we would invite to become associates. And this leads to the careful choice of associates. When I talk about an open door policy, for those that come in as locums, is you make them understand that they are free to stay or free to go without any ill feeling. Appreciate the strength of diversity so that you can aggregate different skills and competencies, and crucially encourage personal development throughout the practice. We provide an allowance, for example, for attending conferences, workshops, which cannot be cashed. So that if you don't attend conferences, because we want people to increase, improve, develop their skills, you can't be paid in kind, which means that you are literally forced to go on these workshops. It is important in clinical practice to have autonomy, so that the doctor feels that they are in charge of the decisions that they make, but the patient belongs to a practice, and the environment makes it possible for sharing, for consultation within the practice. But there is autonomy in clinical decision making. But at the same time, it is important to put in place a system where if there is a feeling that maybe some practice is not good for the practice, that it can be brought to the attention of the particular doctor, and succession planning. This can only happen if you mentor younger colleagues. You show them that you are not afraid of them. And also the other thing I have discovered when we started, I was worried because sometimes we would have a ROCAM who is sitting in our office, and there are lots of patients waiting, and the patients did not want to see the ROCAM. They wanted to see me. With the time, you educate your patients that you have confidence in your colleagues, and patients will agree to be seen. That has been an amazing revelation to me, that patients will follow your direction, especially when they call you and they want an appointment. You don't have, you can't give them an appointment. You tell them that they can be seen by your colleagues, and they ask you, is your colleague as good as you? You tell them, yes, even much better. You affirm your colleagues. And finally, back to William Osler, that the good physician treats the diseases, the great physician treats the patient who has the disease. And this plays in to the ecosystem and the value chain that I talked about, because the patient that it requires you as a doctor to pay attention to their various needs. And finally, the future belongs to those that can imagine it, design it, and execute it, as Sheikh Maktoum, the ruler of Dubai, has said and has demonstrated that it is possible. Thank you very much. I do hope we will be given a few minutes where we can have a Q&A session. Thank you.
Thank you very much, Professor. That was an enlightening presentation. Yes, we do have a few questions. If you'd please allow me to read them out, and then you can tackle them one by one. First question here is, right. So with the changing landscape in medical entrepreneurship, do you believe it's an indispensable necessity to additionally train in MBA, health system management and governance? Professor.
Yeah, thank you for that question. Yes, it is good for, if you are going into health management, to train in MBA. But what I think is very crucial is for medical schools to relook at their curricula. If you go to the School of Law, they are taught some elements of business, and they must pass that. They must pass accounting, because it is considered to be very important for them to be able to run their practices. So I think the first thing is to maybe just include a module on business, the business of medicine in medical school. For those who say you are thinking about partnerships, then, like I said, within that group, one person who is more interested in administration could do MBA, so that they bring in a greater competence in terms of management. I can tell you that, and I do hope many of you will agree with me, that we as doctors, we are very poor managers. Sorry, any other question?
Yeah. Yes, we have quite a couple actually, but luckily we still are within time. Another question here is, how would one ensure that they are not voted out by the board of the nonprofit that they have founded?
I think that is why it is very important to understand when you create deeds of partnership, you will integrate. If you have founded, say, a non-profit, and you are founder, you can put in the founder rights. You can put founder rights, so that and remember, even in big business, it has happened that founders of businesses have been voted out by people that they brought in onto the board. So it's very important that when you develop your deeds, that deed has stipulates how a founder can be removed. Yeah. So you take care of yourself, and that's why I again said, understand the legalese. Don't just sign. Take counsel. Let somebody take you through the deeds, the legal documents that you are signing. Thank you.
Thank you, Professor. There's a comment here that unfortunately, most of us doctors don't like growing others. We invite someone to be an associate, but we still want to withhold patients from them. That's how we get to miss the bigger picture. Is there anything you'd want to add on to that statement, Professor?
Yes, I think it's the disposition of the senior doctors that is very, very important. And the way I see it is that most doctors have certain personalities. And most of us doctors, we have personalities of control. And you really have to intentionally share what you have. When you start, you'll find that your junior will be seeing a few patients and you're seeing most of patients. But you must know that with the time, there will be an inflection point. And that's why that bigger picture is very important. When we started our clinic, I think I was seeing about 60 to 70% of the patients. Today, I see less than 10% of the patients. And I now benefit from building these young doctors because I'm able to do many other things and the practice is still continues to grow. So it's really the disposition, a personal decision, an intentional attitude to your juniors. Grow them, because when you get the inflection point, they are the ones who will grow you. Thank you.
Thank you, Professor. A few more accolades here. Wonderful presentation. More suggestions on networking platforms for entrepreneurs. Somebody else says, research financing as part of private practice. It is possible. Thank you for that comment. Great insights, Professor. Reflecting back, what was the most important contributor to your financial breakthrough in medical practice? Professor?
Difficult question, because sometimes this is a process. It is not an event. And I think the process is really, when you start as an individual, is doing the right things in medical practice and looking at medical practice as a marathon. It is not a sprint. I know that we are late bloomers as far as the finance world is concerned. What do I mean by that? It takes much longer time in university. By the time you're starting your practice, your colleagues in other specialties, I think somebody can mute their mic. Your colleagues in other specialties will be steps ahead of you, and the temptation your temptation is to catch up with them as fast as possible. And that has been the undoing of many doctors. Then sometimes, especially if you're in the surgical fields, you find that you are doing things that are not defensible from a clinical perspective. So I think the breakthrough in success in medical practice is really your value system, your integrity, and ethical practice. I think that is the single most important aspect. But I must say also, the decision to have partnership also made a lot of difference to my practice. It enabled me to continue working in the public service and also succeed in private practice. Thank you.
Thank you, Professor. Another question here. With your vast experience, what are the possible sources of financing healthcare entrepreneurship? What do you prefer and why? With your vast experience, what are the possible sources of financing healthcare entrepreneurship? What are your preferences and why?
Yes, there are various sources of financing, like I said, but I think many times it will be a mixture of financing. There's a traditional banks, which I said many times don't understand us because they insist on collateral. They are funding medical funds that specifically are geared towards financing healthcare. And I think these are great if you are able to identify them. And the reason is these ones understand healthcare financing. Many times they'll give you time before you start repaying. Many times they will work with you, and many times they will also help you set up systems. That's why the best financing is not just getting money, is getting money and getting entrepreneurship training. Again, also some banks may have started having those kind of approaches to entrepreneurship, that they just don't give you money. They help you in developing systems and processes for your practice. Yeah.
All right, thank you. Somebody else asks if you could please comment on the franchise model.
The franchise model is a good model. Like I said, I have been involved in the Equity Afia franchise model. And the beauty of it is the franchise model enables you to scale pretty fast, because the franchisees are the ones that take charge of that franchise. The major challenge in a franchise model is maintaining the brand, making sure that the franchisees represent what the franchisor wants. Now, that is a big challenge, because it means that you have to develop a central management that assists the franchisees. And if you want to take advantage of a franchise, that this central management model will give certain overarching services like procurement. For example, in medicine, if you have like now Equity Afia is about 110, 20 clinics. If they can source all their drugs together, which is happening, they get to apply the economies of scale. They get drugs and other medical devices at a much discounted level, and therefore they can pass this on to their patients. And this is happening. The average consultation is about 50% less than equivalent healthcare clinics. So franchising is a good model for scaling up. Thank you.
Thank you, Professor. Another question here. Has your key financial breakthrough been through business of medicine or elsewhere?
My business of medicine. And a financial breakthrough is I don't want somebody to look at financial breakthrough in terms of a quantum. It is in terms of meeting what you set out to achieve. It is in terms of looking at what is it that makes me happy. It is not in terms of the quantum of money, because if you're looking at the quantum of money, you will never get satisfied.
All right, thank you, Professor. Another question here: how do you handle a partner who thinks they are more important than other associates?
Well, that should start right from the time that you choose your partner. I always say that it is almost like a marriage. You look at somebody that you are able to communicate with, that you have a sense of complementarity, that their disposition is towards team players, because even in a great team, you find that a team is not great if certain players think they are much more important than other players. Yet, you may have that player is the one that gets you the goals, but he has to be fed by other people. So it's a question of candid talk all the time, constantly, meet regularly, look at emerging issues and solve them in good time.
Thank you. Is there any advice you would give in regards to choosing legal counsel? The comment here is also, a lot of lawyers use generic templates that may not capture your unique nuances and desires, or do not take time to educate their clients, e.g. on the pitfalls and how to navigate them in the documentation. So the question here is, any advice you would give in regards to choosing legal counsel?
I think it is very important to, just the same way that if you are sick today, you'll take time to choose a physician to see you. You'll take time, sometimes you ask around, and then you settle on somebody that you're comfortable with. It is the same with the legal counsel. You need to take time. You need to look at what are the competencies of the person that you're choosing to assist you. Yes, they use template, but that's why you have to read. You have to be taken through that document so that that document reflects your desires, not the desires. It's like an architect. When you commission an architect to design a house for you, it should not be the architect's house, it is your house. And you must insist, and if this particular lawyer just wants to use templates, you can take a walk and look for a different counsel. Thank you.
All right, there's a question here on research financing as part of private practice. Is it actually possible?
Very difficult in our circumstances, yes, but I know a couple of people who have actually made research. They don't do private practice. They are doctors and they do research. They are retained by even multinationals to do drug trials. So it is like monetizing what you do best. That's what you really have to look at, monetizing what you do best. So it is possible. It may take you quite some time to break through, because you know that to be for people to have confidence in you, they want to see your previous results. So the runway is much longer than maybe when you start seeing 1 or 2 patients. But sometimes the rewards can be very satisfying.
All right, thank you, Professor. Now what we have here are very many accolades. Allow me to just read them through. Very good presentation. Thank you for championing entrepreneurship in medicine. Somebody else says, excellent presentation, Professor. Excellent presentation, nice presentation. Excellent and informative presentation. Thank you. Great presentation. Thank you, Professor. Excellent presentation. A very candid and fantastic presentation. Very nice presentation. Would you emphasize that we need to be adequately insured? That is health cover, malpractice, and life cover. I think he's emphasizing that we would need to be adequately insured.
Even your practice, please insure. When you buy equipment, please insure.
All right, thank you. More accolades, useful insights, great presentation. Thank you, Professor. Models for value addition outside of hospital setting, away from acute illness or critically ill requiring immediate attention, home care services for chronic conditions, supportive services for workplace wellness. Thank you for sharing failures. Many times doctors are seen as perfect and people who cannot fail. Thank you for that comment. Somebody else says, wonderful presentation. Thank you, Professor, for this. This applies also across all healthcare professionals. All right, I think we have handled all the questions and comments. Professor, would you have a parting shot? What would you want this audience of 250 something people to take home as we start the day today, Professor?
Thank you very much, Aida. I'm really impressed by the number of people that logged in and what it means that there is great hunger for doctors wanting to understand entrepreneurship in healthcare. I want to encourage them that they can do it, that it is possible for us to succeed in the field that we have spent many years learning. But I want to emphasize that we need to open our minds to see the greater picture, and we need to collaborate to work together. I think it's a saying from Burkina Faso that says, if you want to walk fast, walk alone. If you want to walk far, walk with others. And I want also to let this audience know that since I retired from the university, I have spent quite a lot of time on a one-to-one with younger doctors, people who want to start a partnership. And I think I see myself doing more of that. And I'm available if you need to chat, run your ideas by me, just contact me. Thank you.
All right, thank you very much, Professor. We'll be sure to type down your location and business contacts before this call ends. But yeah, otherwise, just to thank everybody for tuning in, joining in very early in the morning. For this and more, we usually hold every first Friday of the month wellness forums, and the next one is due on the 3rd of May, 2024, 7 a.m. That is it from me. I will pass the baton back to Dr. Diana Ondeki for any closing remarks. Dr. Diana?
Yeah, thank you very much, Aida, and thank you very much, Professor Macharia. Thank you for honoring the request to come and speak to us. We are extremely grateful. Most of us, truly, we have this kiosk mentality and very little innovation as regards healthcare. And what you said, that if you're not seated at the table, will be part of the menu. So really, I'm sure people have been inspired to really try and think out of the box. And at least you've told us that there are so many areas that we can consider and maybe hopefully have our breakthrough in those areas. There's one comment that was posted here that by Magdalene Kogo, I have learned and received a lot of relevant advice from Prof that many of the financial literacy and investment CMEs I have invested in. The personal touch has really helped. Way to go, Professor Macharia. You're indeed a beacon of light to us who look up to you and hope to follow in your steps. So thank you for a very wonderful presentation. So thank you very much, Prof. I'm sure everybody here, I'm echoing the words when I say we are grateful for this talk. So thank you very much, everybody, and have a good day. So, Prof, would you like to say a few remarks to close?
No, I think I had said what I wanted. I just want to encourage, especially the young doctors. I have seen that some of them are talking about whether you retire, whether you remain in public service. I think that is a personal decision. I personally never wanted to retire from public service because I felt like it was really my my calling, and that is one of the reasons why I formed a partnership, so that it could allow me to continue in public service and also develop my private practice. So I think it is your personal decision. If you find that you're having problems juggling too many balls in the air, then it will be a great decision, and it will be an honest decision that I can't do this too. And I think the most important thing is always ask yourself, are you sitting in a public healthcare facility, you're taking a salary, but you are not giving in return what is expected of you? And I think that is where we as doctors sometimes, we have been blamed for concentrating too much on our private practice and not giving enough in public healthcare. But it is possible if you organize yourself to be able to give adequate attention to public healthcare and adequate attention to private healthcare. It just needs you to organize yourself. And then you'll find that this austerity may tone down. Thank you.
Thank you very much, Professor Macharia. So thank you very much, everybody. Thank you for logging in today. As Ida said, we'll be having our next Wellness Forum in May, so welcome. So thank you, everyone, and have a good day.